what if I told you not every child with strep throat needs to be treated with antibiotics? I know sore throat, strep throat are all very painful and make our kids uncomfortable. But by the end of this video, I will explain to you what kids we usually recommend treatment and why you should always take a look at your child's butthole whenever they're sick, especially the babies. So strep throat is an illness a lot of us know and commonly causes sore throat, fevers for both children and adults. And it's actually been around for like a long time. And the bacteria that commonly causes strep throat is something we call strep pyogenes, or the group A strep. So this same bug can also cause ear infections, pneumonia, scarlet fever, which has to do with a rash, and even skin infections. It just depends on what part of the body it prefers to go at the time. Strep throat is very common in school age kids, especially kids older than 5. And because kids are a whole petri dish of infection, it starts from one person and spreads across the whole kids in school. So what about kids younger than 3? Strep is not very common in kids younger than 3. They typically present and manifest more viral symptoms like fevers, runny nose, and even when they get infected with strep, we still don't recommend treating them, and hang on to that thought, I will talk about that shortly. So where do we get strep from? It's one of those things, just like the viruses, is transmitted from nose and mouth secretions from one person to the other, which is why it's very high in schools. So kids sneezing or coughing without covering their mouth can easily transmit from one person to the other. It is also easily transmitted between kids who play contact sports, so maybe wrestling and they're close to face with each other. That can easily allow them to transmit strep from one person to the other. Sharing utensils like spoons and cups, especially in a household, can also increase the chances of another child getting strep if a sibling already has it. So what symptoms can kids manifest when we are suspecting strep? Most kids have sore throat, fevers, headaches, joint pains. Some other kids may have belly pain and have swollen and painful lymph nodes, which are the bumps you see around the neck. In some other situations, some kids may develop rash, which is what we usually call the sandpaper rash. And in some cases, they may develop the rashes and fevers, but not the sore throat. And this is what we typically refer as scarlet fever. A lot of people have asked about invasive strep infection, especially with the recent news. So this is a very rare and serious infection where strep goes into the bloodstream and makes a child sicker. It is different from strep throat, even though it's the same bug, and typically tends to make kids sicker and sends them to the hospital much faster. So your child has all the symptoms suspicious of strep, the sore throat, the fevers. How do we actually tell it is strep? We do that by a simple testing called rapid strep test. While looking in the mouth and seeing the red and the white spots at the back of your child's throat increases our suspicion for strep. Viruses can give you just about the same picture, so testing actually makes us say positively that this is strep. Running a strep test in a hospital or clinic can be very simple, but obtaining the sample is very uncomfortable. And that's because we usually have to use a stick, which contains a Q-tip at the end, to clean the back of a child's throat to be able to obtain a sample. Sometimes we have to make them gag to be able to make sure we're getting a good enough sample for that. So positive strep test, it's simple. Your child receives antibiotics and gets treated. But a negative strep test, we typically send for cultures only because some of the negative strep tests are actually falsely negative and may indeed be positive. And in those scenarios, we typically send them out for cultures, which takes about 24 to 48 hours to come back and let us know, is this a child who really has strep? Or maybe still does not have strep and it's still a negative culture. So here's a scenario a lot of families ask about. So one child tests positive, do I need to get the other kids to get tested? Not necessarily. It depends on if the other kids have symptoms or not. If the other kids have no symptoms, they may be considered carriers of strep, and we don't necessarily test them because we don't want to give them antibiotics they do not need. So one child who has symptoms get tested, can be treated. Other kids can only be tested if you're suspecting, or maybe if they develop symptoms at any point in time. In other scenarios, your doctor may recommend testing in a house where a child has a high risk factor, and that's something your regular doctor can definitely help you decide. So what about kids younger than 3? What kind of testing can I do for them? So like I said before, children younger than 3 rarely get strep throat, but they can get what we call periannual strep infection, which essentially means they develop a redness around their butt, which is why we always check, and that's something we can test. So as much as we don't want to gag the kids who are younger than 3 and obtain a sample for them, you can use the same stick depending on what your lab accepts to get a swab from the rectal or anal area and send it up to get tested to see if it's strep or not. Now we are going to jump into treatment of strep. How is strep treated? Just like all infections, we always treat for the symptoms, but because strep is a bacterial infection, kids who are diagnosed with strep and are older than 3 years of age also get antibiotics to help with the treatment. And here's the main reason why we treat for strep. Untreated strep infection can actually cause a lot of complications. One of the major ones is called acute rheumatic fever, which is a disease that subsequently affects the heart as the kids get older if their strep was not treated. It's also one of the main reasons we always recommend kids who are diagnosed with strep to make sure they complete the antibiotic course they're given, because not completing medication still keeps you at risk of developing acute rheumatic fever as your child grows up. So when it comes to treating strep, we have options. We have options of injection, which I really love, and then we also have options of oral medications. The injection is called injection penicillin. The penicillin always is one treatment and then that's it. Your child does not receive any other dose of injections, but it is painful. So I usually leave that option for families to decide. As much as it gets one dose and that's, you don't have to worry about daily medications, you also have to discuss with your child about the pain they have to endure when it comes to that shot. The other option are oral medications, which can be a pill versus a suspension based on the age of your child, or just necessarily the choice they prefer. Amoxicillin is a common one we use, but also some places use penicillin. That dose should be given for 10 days just to make sure still it maintains and protects your child from acute rheumatic fever, which they may be exposed to if they don't complete the medication. So what about perianal strep, which is the infection that I mentioned that babies can get around the butthole? So as much as we don't treat babies and kids younger than 3 for strep throat infection, we usually treat them for perianal strep with amoxicillin or penicillin, and that we usually give for 10 days or as recommended by a pediatrician. And of course, in kids who are allergic to penicillin, the other options like azithromycin or even clindamycin for those who are carriers, and there's so many other options that a regular pediatrician can discuss with you to make sure your child is going to be treated adequately for strep throat infection. So here's the best part about starting treatment for strep. Within 12 hours of your child starting medications, or rather after 12 hours, they can go back to school because they are no longer considered infectious. So once your child gets diagnosed and treated, we always recommend get the medication from the pharmacy and start it immediately so they can go back the next day to school and not miss a lot of school activities. So one of the home remedies can help your child recover from strep. Pain medications, popsicles, lots of hydration just to make sure they're keeping their mouth and their throat moist, and also things like rest can help them recover as they continue to take the antibiotic. So here's one thing to remember if your child recently has strep. Make sure you change your toothbrushes, because otherwise they will continue to reinfect themselves if they're using the same toothbrush they used before they contact the strep. So we have talked a lot about strep, but here's some rundown summary that I want you to remember. 1. Strep can be scary, especially when we talk about invasive strep, but the most common infections like strep throat are mild and are easily treated with antibiotics. Your child is older than 3 years of age and has symptoms and gets tested and diagnosed with strep infection, we always recommend to ensure they finish the medication for the full 10 days, even though they are feeling better, because this protects them from acute rheumatic fever. If your child is younger than 3 and develops symptoms that may look like strep, or maybe another sibling in the house has strep, we don't typically recommend getting tested for strep, but you can take a look at their butthole and see if you're seeing any redness that needs to be tested and treated for that. If you have not watched my fever video, go check it out, because kids with strep can also have fevers. I want you to leave me a comment. Let me know, has your child ever had strep, or have you ever had strep before? I had strep and it was horrible. So I'd like to hear from you about the experiences with strep, or any questions you have.